clock is winding down.
I know I've got a premature baby that has been compromised, that has been stressed.
6 women are in the home stretch of motherhood. After months of anticipation, anxiety,
Oh yeah, she's rupturing right here.
and finally joy,
Oh, look at you, you're so little.
the miracle of birth is about to unfold as the countdown to a special delivery begins. At Washington Hospital Center in Washington, D.C., 22-year-old Shonda Wilson is pregnant with twins.
Stop, it hurt right there. I know, but
She isn't due to deliver for another 16 weeks. But 2.5 hours ago, she went into hard labor.
It's the baby. Push the baby out, and it'll be over. Push the baby out.
Shonda started dilating at 24.5 weeks. Every effort to stop her preterm labor has failed. Now her babies will be born premature, putting their lives in jeopardy.
there we go. Good job. Good
Okay.
job. Breathe, and breathe. You're okay.
Okay, hold on 1 second.
You're okay, sweetie. B is now footling.
The first twin is out, but he weighs only 1 pound 4 ounces, and he's not breathing.
They're working on it now, okay?
We intubated the baby, we put a tube into the lungs. Through the bag, we are breathing for the baby.
Born at 11:31, going to the NICU.
Unable to breathe on his own, baby A is in trouble. He is rushed to the neonatal intensive care unit.
And we're still waiting on baby B.
You can see the end of
Meanwhile, the delivery team directs its attention to baby B. He is still inside the uterus, which might indicate further problems.
It's in its own separate sac, and it's not exactly coming down yet, so we have a little bit of time to give her something for pain, and then we'll work on delivering the second baby.
Are you having any pain at all?
No.
Nothing?
Tracy Poris is 37 weeks pregnant and about to give birth for the last time.
You're itchy? Okay, I got something for that.
She was diagnosed with cervical cancer midway through her second trimester.
I hadn't planned on having any more, and it was probably a blessing that I did get pregnant because that's how I found out. When I got pregnant, I went to have my pap smear, and it came back, you know, with abnormal cells, and I went in and he did the biopsy, and that's when we found out.
Okay, let's fire up the Benadryl first, okay? You allergic to anything?
No.
Tracy's oncologist at Washington Hospital Center warned that the cancer could be deadly for her and the unborn child.
He thought he was going to take out most of the cervix then, and if he did, she may not make it. Then he went back in 2 weeks later and found out that it was okay. He said it was a miracle, it was a blessing.
You feeling sleepy? Good. Okay, well that was your Benadryl. Okay, next.
Every 4 weeks, her doctor has checked to see if the cancer was spreading. If it did, Tracy would likely have a spontaneous abortion.
I was nervous. I was more nervous. It's a possibility I could have carried her, but more than likely I couldn't have.
The pregnancy would be at risk if she needed surgery on her cervix during pregnancy immediately, and then later on in pregnancy, her cervix could weaken so that she could lose the baby at a later point in gestation.
Cancer is not the only serious hurdle she's facing. Tracy also suffers from an incurable disease called Crohn's that causes inflammation of the small intestine.
Her Crohn's disease did flare during pregnancy, and she presented with abdominal pain. We had medication to try and treat the inflammatory process.
Left untreated, Tracy's Crohn's disease robs her baby of nutrition, affecting its growth and virtually starving it. An ultrasound also revealed that her amniotic fluid is decreasing to a critically low level.
It's been kind of bumpy, I work nights, and I get the phone calls, saying, she's sick, so I had to rush home.
We need to work on getting you to contract and get you in a better labor pattern. I mean, you're contracting about every 1, 2, 3, 4, 5, 2 to 5, 1, 2, 3, 4, 2 to 4 minutes, about 60 to 90 seconds. But we need to get stronger contractions so we can get you delivered.
The possibility that Tracy's problems might harm her baby has prompted the doctors to deliver her early.
So when I start feeling pressure, that's when I let you know.
You're going to tell me when you start feeling pressure, and that's my distant early warning signal.
Okay.
Victoria Better is about to deliver a baby. Victoria is in the 34th week of her 9th pregnancy, fearful of what lies ahead.
At this moment in time, I'm a little nervous because we're about to go in finally to get the baby out.
Let's go.
Despite 8 previous pregnancies, Victoria has never been able to carry a baby to full term.
Can I get a 5-year-old roll, please?
With her history, she's had multiple recurrent losses where the baby has died inside of her. So I began to be very suspicious for the possibility of her body rejecting a pregnancy. And in fact, that's what we found.
Victoria has a serious condition that is jeopardizing the life of her baby, just as it did 8 times before.
There's a particular syndrome that we've identified called the antiphospholipid syndrome, where her body reacts against certain cells that relate to the pregnancy and results with the loss of the baby.
In essence, Victoria's body treats her embryos like foreign objects. Her uterus becomes inflamed, her blood clots, and she goes into spontaneous abortion.
Not sure why this pregnancy has come so far and the other ones haven't, that I've miscarried. So we want to play it safe and get the baby out now.
Victoria's due date is still 6 weeks away, but delivery can't wait any longer. Her condition is putting her baby at serious risk.
She has fetal growth restriction, which in this case is severe. This baby is probably measuring just under 4 pounds, and that growth restriction has been progressive. I've watched the baby get smaller and smaller.
Huh?
Yeah. At this point, we're showing signs of the potential for sudden fetal death. In essence, this is probably as good as it gets, and I raise the question, how close to the edge do you want to come?
We need respiratory here too, please.
Respiratory from 5A?
Yes.
Victoria's baby is not getting enough oxygen. If doctors don't get the baby out now, it could suffer brain damage, or worse.
Lots of hair, Victoria.
Here's the baby.
My little one. Well, we're glad to see you.
After 8 failed pregnancies, Victoria has finally succeeded in bringing a new life into the world.
To see a woman cry in front of me, I like to stand and watch her because often I have women crying in front of me for all the wrong reasons. So to have a patient in front of me crying for the right reasons just warms my heart.
Beautiful.
She's here.
You got a lot of hair. Thank you, God. What's her name?
Baby girl better right now.
We haven't gotten that far. We took it one day at a time, you know.
Really?
5A nursery, intermediate care, neo service.
But at just 3 pounds 4 ounces, Victoria's daughter is not yet out of danger.
I'm done.
Can you push your back out for me?
Shonda's doctors are preparing to deliver her second twin, but they are concerned about its position inside her uterus. They need an ultrasound to find it.
Well, she's uncomfortable. We have the time. The baby's doing fine. And we may need to extract the baby, so it's going to be uncomfortable for her. So.
And you don't see anything in that sac anymore, actually, and here's the baby's bottom. You can see the end of the spinal cord.
Baby B is in a separate amniotic sac, which explains why he is coming later than baby A.
She just broke the water.
Push down, real hard, push. 6, 7, 8, 9, 10. Good, one more time, and push down, real hard, push. 2, 3, 4, 5, 6, 7,
Baby B comes into the world in severe distress. Weighing just 1 pound, 11.5 ounces.
It's a boy. All right.
Congratulations.
Thank you.
Thank all y'all.
2 boys.
The baby isn't breathing on its own.
You gonna breathe for us?
The point is not so much survival as it is the quality of survival. Because we want these babies to survive, do well, both physically and mentally, and have normal functioning vital organs.
I feel shocked, actually. You know, they haven't sunk in yet, so I'm waiting for them to come home. That's all I want. I want them to come home.
But the babies won't be going home soon. Shonda and Luke's twin boys are now in a fight for life.
That we have to go over, okay?
Kesha Scott is worried. Her unborn baby may have a disease.
Sometimes when the babies are big, they're difficult to get out.
In my heart, I believe he'll be fine. I don't know, but I did everything that I could to make sure that he was.
There's risks. We worry about the risk of bleeding, infection, injury to the bladder.
Kesha has advanced diabetes, which puts her baby at risk for getting the disease, having congenital anomalies, or even being stillborn.
I did everything that I could. I never missed a shot. I ate as healthy as possible. I cut out everything they told me to cut out.
Diabetes can also cause a baby to grow very large very quickly, making labor long and extremely difficult.
Okay, so we don't know how big this baby is. You have had diabetes, you're on insulin, but you've been in pretty good control. Okay, so that could be one of the reasons the baby's not coming down. So I'm worried if the baby's wedged itself, you know, in a certain position. How have your blood sugars been in labor? Pretty good?
They've been in the 80s, right?
Okay, Layla, they've been in the 80s?
Yeah, she's been like 102, 108 the last 4 hours.
Okay, so that's good. So
if Kesha's blood sugar level soars too high, her baby could develop diabetes after it's born.
Hopefully the baby won't have very much fluctuations in its blood sugar. I mean, that's going to be the #1 thing that the pediatricians are looking at. Okay.
If Kesha's blood sugar level drops too low, she could go into a diabetic coma.
Once the baby's born, the neonatologist will be there to look at the baby, to check the baby's blood sugars. That's going to be the #1 thing. Because if the baby can't maintain, you know, the blood sugars, the baby will have to go to the nursery.
Right now, Kesha has been in labor for more than 25 hours, and still no baby.
The reason that the baby's not coming down is this is something called a face presentation. The baby can't come out in the face presentation. The baby would just sit there like that. Her cervix wouldn't dilate anymore. It would probably end up stressing the baby. We'd probably end up seeing decelerations eventually in the baby's heart rate. But, you know, the baby has to come out.
The face-first position is dangerous for the baby. It could cut off his oxygen supply by compressing the umbilical cord.
I was very hopeful I could have a vaginal delivery, but it's not working out that way.
Just worried about both of them, that's all. She did everything she possibly could. It's crunch time now.
I'm worried about it being a difficult birth. Not really worried about her, but just, you know, getting the baby out of the pelvis. Remember, Kesha, I told you it was going to take a little bit longer?
She doesn't have anywhere to go, Dr. Johnson.
I felt one, but I didn't sweat it. I felt the strong one right there. Oh. Hi. Okay, we're not progressing?
Vicki Hunter is 36 weeks pregnant and has been on bed rest since going into preterm labor last month.
Do you think this baby's bigger for you? You do? A lot bigger?
The last month that I've been on bed rest, the whole thing that's going through my head is this baby's never coming out. I'm going to be pregnant forever.
She checked into Washington Hospital Center at 10:40 last night with contractions and is hoping her long wait is finally over.
At this point, Vicki, what I'm feeling is the baby has not dropped down out of the pelvis.
It took me a while to realize, okay, that I may actually be in labor when my water broke this time, because I'm thinking, this is not happening.
Last night, she kind of wasn't under the belief that her water did break, and I was like, no, it broke, you know.
Can I have the amni hook? I feel like there's some membrane there, like some forewaters.
But 6 hours later, Vicki's labor stalls. When her doctor tries to insert a fetal monitor, she discovers the cause of the problem.
Vicki broke her water, but sometimes there's a two bag, like she could have had a higher leak and there's still another bag there. So I'm trying to actually break that bag. There we go, and get more water. And that actually may help, yeah, I got a lot more water. That actually may help her progress a little bit better. So, oh, there, lots of water. Okay, Vicki, you're gonna feel wet. She presented with what we call rupture of membrane. She had lots of amniotic fluid out. She could have had a high leak from that amniotic sac, and there was the base of the sac still above the baby's head, and there was water in front of that, and that could be why the cervix hasn't been dilating. So let's see what happens over the next 2 to 3 hours, okay? Because now the waters are truly broken, and hopefully the contractions will be adequate. We'll be able to tell.
Vicki's slow progress is not a good sign. If her labor continues to lag, Dr. Johnson will likely have to resort to a C-section.
Vicki, you're comfortable with your epidural? Oh, yes. Okay, very good. All right, so then we can up the Pitocin without fear of you being in pain. Right. You should be progressing fairly rapidly within the next 2 to 3 hours. Okay. I mean, if we're at the point in 3 hours when I examine you and your cervix hasn't changed, then we're talking C-section.
Oh, Lord.
I know.
Okay.
But let's see. There's only so much Pitocin that we can give you, and that's why we have the IUPC in.
Okay.
Most women who it's their second baby, they usually change 1.5 centimeters an hour, okay? So if she's still 4 centimeters in 2 to 3 hours, she's not gonna change and she's not gonna make it.
All Vicki and Dwight can do now is wait.
Keep our fingers crossed. Progress. No C-section. No C-section.
Well, I'm going to do the epidural anesthesia now. The most important thing is that she has to stay still.
I just want to move to the next level. I want it to have the baby.
I don't feel like it's really progressing, so I want to up the Pitocin. I think this will help me sustain a little bit.
I'm setting the pump, 10 cc's. This way she'll have continuous medication throughout her labor.
Relax a little bit, okay? Just a little bit more pressure. I'm giving us a little more medication, all right?
Okay.
I've never been pregnant, so I don't understand, but actually...
This is just very sensitive.
Yeah, I understand. I can understand that. I think she's feeling better now. How do you feel?
I'm a lot better. I'm just tickled.
She's
just tickled.
Very tense.
I'm just glad that I'm at this moment. I'm glad my water broke, so they can't send me back home.
Okay, push like you're gonna have a bowel movement. Right?
Tracy has been in labor for 6 hours.
Well, your baby's head is almost out. You want to feel it? You don't want to feel it? Okay, well.
Despite having cervical cancer and Crohn's disease, she is praying for a healthy baby.
You have a contraction, do you feel it?
Hang in there, Trace. You're doing a great job. Okay, here, push out the shoulders, gentle. Oh! Okay. Breathe. Then your final position is LOA. Oh, yeah. Okay. Oh, Tracy, she's beautiful. Okay, sweetie, talk to me. Yeah, girl. Oh, Mommy, it was tough. Well, let me show her to you, and then we'll swaddle her back up again, okay? Okay. Here we go. Show Mommy your back. I got her. Show Mommy how pretty you are. Look at how nice. Yeah. See, her reflexes are normal.
The baby's cries are a promising sign. But with Tracy's serious medical problems, it is too soon to know if her baby is as healthy as she seems.
Feeling that pressure?
It's been 3 hours since the medical staff at Washington Hospital Center increased the Pitocin to jumpstart Vicki's labor.
Because have you guys even had her push it off?
No.
Okay.
Her contractions are finally strong enough to start pushing.
Let's take, what I want you to do is take a deep breath in and hold it like you're going underwater, okay? Hold it and push out like a bowel movement. Count to 10 for her, somebody. 1, 2, harder. 3, push harder,
4,
Vicki.
5, 6, 7.
Push my fingers
8,
out.
9, 10.
Now deep breath in and push. Come on, push again. Push.
1, 2, 3, 4. In your bottom. 5, 6, 7, 8, 9, 10. Again, let it out. Let it out.
Push out, Vicki.
Let it out. Take a breath.
Deep
Take a nice deep breath in and come right back.
push
And push
out.
down.
Push
Push
your legs.
out.
Push your legs,
2,
Vicki.
3,
Harder.
5, 6, 7, 8, 9, 10.
Okay, and just relax.
Okay, relax. Okay.
Vicki. Okay, now you've stopped making a little progress, and I don't want you to get tired.
Before long, it becomes evident that Vicki isn't progressing as expected.
The epidural, she can move because it doesn't paralyze you like a spinal, but she can't feel anything. And so she's moving her body in ways that are not productive to the baby coming out of the birth canal. So we're going to give that a little time to wear off and see if she's a more effective pusher.
But an hour later, Vicki's baby is suddenly running out of time and is now in trouble. Shonda's premature twin boys are just an hour old. As she sees them for the first time, they are in critical condition, at risk for brain bleeds and lung infections.
He's a little bit smaller.
That's why they got this thing over him?
It helps him with his body temperature.
Okay. Yeah, he laying like this for a month, but in a couple more months, he'll be like, sit down. Go lay down. Stop doing that. You may never tell her stop. No.
It's exciting because they weren't due till February. It's November now, so as long as they're okay, I'm fine.
Baby A is improving, but baby B is on a ventilator, suffering severe respiratory distress. He is also in a humidity tent to prevent the loss of fluids and regulate his temperature.
And I want you to know, just put on your roller coaster shoes, because their life is going to go up and down. That's a reality.
This mother is beginning to get an idea as to how rough the road is that lay ahead.
This is twin A, which is on the other side, right? And twin B is right here. We haven't thought of any names or anything, so we still got to work on that one now.
Seeing their sons for the first time is overwhelming. Each boy weighs less than 2 pounds. They know the road ahead will be extremely difficult.
I'm hoping they, healthy, they survive this, what they're going through right now. I know they're, 3 months premature? And that's a shock to me, because I was hoping for February. I just hope, they come home safe, disease-free, and healthy.
They probably are in for a rough time ahead. The babies are small. The babies more than likely will have some kind of respiratory problems, possibly episodes of sepsis or infection to deal with along the way. If they have bleed in the brain, that's another set of problems that they have to go through. But this is not reality for them right now. Their babies are born, they're delighted, and that's good for us.
But the twins still aren't past the critical point. And as Shonda is about to discover, it will take much more medical care to help them survive. Kesha's baby is stuck face first in the birth canal. Now an emergency C-section is the only way to deliver him safely.
I'm okay.
So far, it looks pretty good. There's not a lot of scar tissue. Yeah, it's still scarred. I'd keep going. We're getting into muscle here. I think it's a little distorted because of her prior surgery. Come down a little bit and see if we can separate the muscle.
Scar tissue from Kesha's previous C-section is making it difficult to get to the baby.
Is everything okay?
Everything's fine, Kesha. Take the knife. Let's see. Give me the Alice, please. She's got a little scar tissue here. What I'm going to do is give this to you. I'm going to see if I can peel the muscle off. Give me another Alice, please, and the knife. Kesha, we're not tying tubes, are we?
No, ma'am.
Okay. Here we go. Knife is down. We're in. That's why it's taking a little bit longer. Remember, Kesha, I told you it's going to take a little bit longer? Okay.
When Dr. Johnson gets to the uterus, she sees more problems.
Kesha, the baby is still kind of high up. It wasn't even coming down.
Okay.
Yeah, lots of swelling. Oh yeah, she's rupturing right here. Look at that. This is why she can never, look at that. Did you see that, Pat? She's ruptured her uterus there.
The scar tissue has worn a hole in Kesha's uterine wall.
She could have had a uterine rupture, which can be catastrophic. And when I say catastrophic, I mean bleeding, fetal bradycardia, even fetal death and maternal hemorrhage.
Fortunately, it is small and not likely to cause a serious problem.
You might have to rotate the baby a little bit because see where the face is and the ears? Yeah, there you go. There's your face. Aww. Lots of pressure, Kesha, lots of pressure.
Okay.
There we go. Of course, just a suction. Ready? Woo! That's a little boy.
He's big.
And we're swollen all over the eyes. There we go, little guy. Happy birthday. Okay, here we go. Simple eyes swollen right here.
Congratulations.
Thank you. Thank you.
How big was the first baby?
7.5.
Oh, okay. This one is a little bit bigger.
Remember I told you guys that the eyes were going to be swollen? Yeah, but that's going to go down.
The baby's swollen eyes are a minor side effect of being face first.
Congratulations.
Kesha is also lucky. The hole in her uterus was not serious enough to harm her or the baby.
Come on, Mr. Bigfoot. There's your big boy. You can hold it up close to her. We just keep him warm, okay? Can you see his face?
How are you, man?
The difficult delivery is over, but a vital question remains unanswered. What effect has Kesha's diabetes had on her newborn son? As a neonatal intensive care nurse, Florence Samuels is used to caring for babies, not having them.
I had apprehensions as to how it's going to be, and then, I was working and I wanted to work till the end.
But when she reached her 40th week without delivering, Florence and her doctors made a big decision.
It's enough for him to stay in. He can come out now.
Florence checked into Washington Hospital Center 10 hours ago to be induced, but almost immediately she started feeling feverish.
Who was checking on me said that I have a temperature and the baby's heart rate was going up. They wanted to start me on oxygen to help the baby.
The baby's heart rate is in the 160. It's a little bit fast, what we call tachycardic, and that's been going on all night. The normal range for the baby's heartbeat is 110 to 160, and hers is in the 167, 170, as you can see.
She had a little bit of a temperature during labor, so just getting some antibiotics, and she's going to be watched. The baby's going to be watched a little bit more closely right after delivery to make sure the baby doesn't have any infection.
Florence's fever could be the first sign that her baby is in serious trouble.
Put me on oxygen for that.
Welcome to the world, baby. Yes.
Now the tube in her mouth, that'll stay just for the air, or what
Right,
does
that's
that
just
do?
to help get rid of some of the air that was in her stomach.
Okay.
Less than 24 hours after giving birth, Victoria Better is finally holding the baby she calls a miracle. A moment she is experiencing for the first time after 8 unsuccessful pregnancies.
All those trials, trying to get this baby. I feel so blessed. Just overwhelmed and very blessed. And I think her father feels the same way. I'm sure he does. Just very blessed and had a lot of faith in the people who were handling our care. Otherwise, we wouldn't have her.
Little Ty Better is in good hands, but at 6 weeks premature, her fight for life is just beginning, and the road ahead will soon become much more troubled.
She's my little blessing.
Janiyah Portis came into the world against all odds, and despite Tracy's illnesses, the baby girl appears to be in fine condition.
The medicine that she took for the Crohn's, I thought would probably, hurt the baby somewhat, but it all worked out.
Who wants to hold her first? Me. Yeah, put her head right in the corner of your arm there. There you go. Okay. Sister.
Oh, 2 boys, 2 girls, perfect. It's all worth it, all of it.
Her baby's head in the corner of your arm. There.
In 6 weeks, Tracy will face surgery for her cervical cancer. But right now, the Portis family is relieved and happy.
You reach in there and touch his little hand.
After coming into the world 3 months premature, Shonda's twins are on their way to the neonatal intensive care unit at nearby Children's Medical Center.
Okay, you get better soon, come visit.
I
Okay?
sure will. Thank you.
You said Monday?
They say they had to transfer them over to Children's Hospital Center, where they'll be doing some more work.
The twins could spend at least 2 months in intensive care.
The doctor explained to me they may run into a couple of problems, being as though they were born so early, infectious diseases, their lungs haven't fully developed. They have to run a lot of work on them, transfusions and everything, make sure their brain and everything is fine, there's no blood in there.
The twins will undergo a brain sonogram to check for cranial hemorrhages. The results will be critical for a hopeful prognosis.
Push, don't let that air out. Push.
Put your hip down, big 4, 5.
Midway through labor, Vicki Hunter's premature baby is in trouble. Her heart rate is suddenly below normal.
Okay, Vicki. If the baby's heart rate keeps dropping after the contraction, we're gonna have to do a C-section. We're gonna try to give you some medication to increase your blood pressure a little bit and to give you fluids and see if that helps the baby.
In a matter of minutes, a final decision is made.
Yeah, we're going back for a stat section. It's down, the heart rate's down. Okay, so we're gonna go to that. New anesthesiologist.
Hi, I'm Dr. Agarwal.
Okay.
How are you doing?
Yeah, do you want us to call these? Either way.
I'm slightly disappointed, but not really. Whatever it takes.
With an unstable heart rate, Vicki's baby faces increasing risks. Right now, delivery is the best medicine.
We're prepping for 2 different procedures. We're prepping for a C-section as well as a vaginal delivery. So we'll hopefully be prepared. If the baby doesn't come, we'll be able to move quickly into a C-section. This is called a vacuum. This part attaches to the baby's head, and then we kind of pump it up to give it actually the vacuum pressure, and we apply it to the baby. And with the contraction, while she pushes, I give a little traction on the baby. Okay, Dad, move straight up towards the arm. Okay, now, Vicki, you're starting a contraction. What I want you to do is push. Deep breath in and push. 2, 3, 4, 5, 6, 7, 8, 9. Deep breath in. Okay, right back in and push. Well, here comes baby. Here comes baby. Just relax. Let's get the shoulder And there's that little baby. Deep breath in, keep going. Push, push. There we go. Hi! And guess what? This is a little girl. Congratulations, Vicki. And she's not even that big. You did it. And you avoided a C-section. I'm gonna take the baby over to Auntie Sedge. Okay. And I said it was a boy, Dr. Agarwal.
What started out as a normal delivery quickly turned into a potentially dangerous situation.
I think that the baby could have been compressing the umbilical cord, and by moving the patient, the baby changed positions, and that's what made the fetal heart rate stabilize.
In a matter of minutes, Vicki's new baby daughter is stabilized.
Oh, sweetheart. Oh, look at her. She's a bully. She's holding on to that guy. Oh, hey, little girl.
After almost an entire day in labor, Vicki must still wait to hear if, at 4 weeks premature, her baby girl will need intensive care.
So little.
2 days after delivery, Victoria has learned that her baby daughter may have something wrong with her heart. With 8 failed pregnancies behind her, the news is devastating.
They're showing up. They're doing a test on the baby. They may have to have me waiting to see her today. Because they said they were going to do an ultrasound.
Left atrium, interatrial septum that's kind of thin and bulging. Just a tiny sliver of right atrium, tricuspid valve, and alpha triangle.
Using an ultrasound, doctors locate the problem.
And I'm looking to see if there's flow crossing the atrial septum or not. Earlier, I saw some little tiny jets, and I think there may be one right down here.
Victoria's baby has a hole in her heart, a condition that is not uncommon in premature babies.
If the excess flow going through that hole is creating any problems for the baby, then it might even need to be closed surgically.
The new information on that was a little overwhelming at first because I didn't know the outcome. But now that I've heard that they're going to treat it with medication for a couple of days, he reassured me that this is something pretty common with preemies. So I have faith.
Victoria is hanging on to the hope that the heart defect isn't serious enough to require surgery. Kesha and her husband Kenny couldn't be happier. They just got Jameer's lab results.
My blood sugar went back down, and he doesn't have diabetes. So it worked out wonderfully.
Kesha's diabetes remains unchanged, but Jameer has a clean bill of health.
The emotions have been pretty wild the last couple of days. More so today. I think she's been asking me a lot how I am. Am I nervous? And I'm saying that I'm not. And I probably really wasn't until today, until they, confirmed that they were going to do the cesarean. And then my heart started pounding a little bit because I started worrying about how it would work out and whatever. So, but I'm fine now.
Like your thumb, huh?
Like his entire hand.
Miss Angel.
A family future that just hours ago was being jeopardized by a terrible disease now seems to be healthy and bright.
Okay. Oh, she's so little. Oh. Oh, she's looking.
Vicki is exhausted after 20 hours of labor, but overjoyed with the newest member of the family.
Look at all that hair, my goodness. Oh.
5-pound, 13-ounce Jessica Amber Hunter.
Oh, and you're smiling. Say hi. I'm here, world. You've been waiting. I've made my debut.
With a difficult delivery behind her, Vicki sets her sights on the future.
Smile. And she's waving. Look at that hand. Say hi. I've arrived.
Quick breath and hold it and push. 2, 3.
2 hours later, Florence is ready to deliver. Doctors have decided to do a vacuum extraction because the baby's heart rate is dropping fast, and he could be in trouble.
10.
Okay, one more push, one more push.
One more push. Chin in the chest. And push. 5.
Vacuum extractions have all but replaced the use of forceps during delivery, eliminating concerns about possible skull damage.
Underway. I need peas for code 2 and Rindy. The baby's head is out, okay? Nice deep breath. Another little push.
Good, okay, shoulder.
2, 3, 4, 5, 6, 7,
Good.
8, 9, 10.
Wonderful.
Here comes our
Look
baby.
who's here. Wonderful. Looky here. Okay.
9:30.
Clamp first. There we go. Congratulations. Okay, let me get the bulb.
Happy birthday.
Congratulations.
Thank you. My video camera didn't work, so I was just hoping I'd get as much as I could on my still camera. Because I want to remember this day.
Here he is. Congratulations. There we go. I know. I got all these greasy, blobby eyes, but you can still give your mommy a kiss. There we go. Look, he's got your dimple. Yeah.
One of the ways you assess how the baby's doing during the labor is by looking at the heartbeat and showing how the heartbeat relates to the contractions. And towards the last part of the labor, her heartbeat was going down and it wasn't coming up that quickly. It can be a sign the baby's not getting enough oxygen. So that's why you sort of try to expedite the delivery.
Because Florence had a fever, her baby will undergo tests to see if he has contracted a bacterial infection. The next 48 hours are critical. One hour after delivery, Florence suddenly learns her baby's son has been transferred to the neonatal intensive care unit.
My baby had to go to the ICU because he was gagging a little bit, and they're going to put him on IV fluids, and he's being started on antibiotics.
The baby's temperature has been unstable at best, going up and down, throughout the day. And when that happens, we start looking for other signs of infection. And what happened with Levi was he started throwing up. The abdomen was a little bit distended. We put a tube into the stomach to drain the air and fluid from there. And we started an IV, and we are going to give the standard combination of antibiotics that we use in these cases.
He's opening his eyes. He's opening. He's opening his eyes. Hi, sunshine. Hi, sunshine. Opening his eyes.
I think it's better if they keep him NPO today too.
I do too, exactly. And tomorrow, if he doesn't bring up anything. Now he, like I said, he's just brought up those small amounts, like a half a cc here and there. And it's been about 3 times he's brought up a half a cc. And actually that was earlier this morning, so.
If baby Levi shows signs of improvement in the next 48 hours, doctors will stop the antibiotics. They hope within 10 days he'll be healthy enough to go home.
The mom and me, of course, I would like to have my baby with me and in a regular nursery, and I would like things to go well with him. But the nurse in me tells that he's being cared for, and what has to be done has to be done.
Nothing in her professional background could have prepared Florence for the concern she now feels. She's all too familiar with the dangers newborns can face.
We're going to get to see Florence.
2 days after being transferred to the neonatal intensive care unit at Children's Hospital.
Hello. You are so small.
One of Shonda's twins has suddenly developed a lung bleed, a condition that is potentially fatal.
Part of the problem with little Mr. B is that complications of being on the ventilator and complications of being premature in terms of having bleeding makes us have to do more in terms of being able to support his lung function.
The twins also undergo ultrasounds to check for possible bleeding in the brain, a a common occurrence in premature babies, but one that can be fatal if the bleed is large enough.
We're looking through the fontanelle. We get to see the ventricles. This is the lateral ventricle right here. This is the midline. And I'm sweeping out towards the other side.
Infants this small can have, about 40% will have some kind of a small bleed, and luckily the small bleeds usually go away. The larger bleeds are worrisome. So we do an ultrasound within the first couple of days and then follow that weekly.
In terms of their brains, we worry because their brain is very immature. The first thing is sometimes they don't remember to breathe terribly well when they're not on the ventilator. So we can give them a medicine called caffeine, which is just like what you take every day in your coffee if you're like me. And that stimulates them to remember to breathe. The other thing that we worry about is that the blood vessels are very immature in the brain, and so they have a tendency to have bleeding in the brain. The head ultrasounds that we did today for both of them look normal. The good thing is that there's no bleeding. We have to still be concerned about developmental issues.
I'm overwhelmed. They're still small, but they're coming along fine. They're gonna have a couple of problems in the future, but they already prepared us for the roller coaster, the ups and downs.
The twins face significant hurdles in the months to come, but every day they survive is a major victory in their fragile lives. 24 hours after delivery, Florence is packed and ready to go. But little Levi must remain in the hospital.
We're looking at some of the outfits for my son Levi. Just going to take it to the ICU and leave it for him there.
Congratulations, Dad! He looks just like you. Oh, you look great. What, you see Mommy and Daddy? Say hi. Yeah.
I'm sad that I'm leaving him back. I would have preferred to take him home with me, but then it's for his good, so that way I'm happy he's in good hands.
Baby Levi's infection is being treated successfully with antibiotics, and he is now able to take formula.
You're a good boy. Good boy.
If the baby continues to improve rapidly, the Samuels can expect to have their family reunited in less than a month. Victoria is also ready to go home, but she too will be leaving her baby behind.
It's time to go home. I'm so excited because I know the baby's well. And I'll be back early in the morning to feed her for the first time.
The hole in little Ty's heart is being treated with medication and should repair itself without surgery.
She's doing wonderful. You know, we were able to actually take her off the photo light for a few minutes to hold her, and she's doing well. She really is.
6 women entered Washington Hospital Center in the final stages of pregnancy. Each one counting down the hours and minutes before the moment of birth arrived via special delivery.